Today I'm going to talk to you about heart failure. As everybody, or I would say the lay people, understand heart failure that is not like that. Heart failure is not cardiac arrest. One something is like cardiac arrest where the people's heart stop working or stops working altogether. Whereas heart failure is what we call it in our medical terms is that when the heart is not working properly, like the heart is not able to perform normally, when the heart is not able to pump enough blood to meet its demands of the other body organs like kidney, liver, brain. So that is the condition when we call it as heart failure. Any cardiac condition can lead to heart failure. It can be diabetes, hypertension. Coronary artery disease is the commonest cause for the heart failure, and even the congenital heart disease, valvular heart disease, all these can also lead to heart failure. So India is in fact becoming a capital of heart failure, or you can say there is an epidemic of heart failure because the incidence of heart failure in India is increasing, and almost 10 crore people suffer from heart failure, and every year about 50 lakh people are added of the heart failure. And once the diagnosis of heart failure is made, 50% of the people die within 5 years if they do not seek proper treatment. So prevention of heart failure is important and treatment is important. Nowadays we have got plenty of treatment available for heart failure. When a person becomes symptomatic, means like he's not able to perform his daily activities, even going to the toilet he becomes short of breath, he's not able to do his routine activities, and there is constant fatigue, there is discomfort in the chest. So that time the person should go to I would say the cardiologist or the cardiac surgeon and seek their advice. And if on echocardiography the heart function comes down to be below 25-30%, then we diagnose them as having heart failure. And once the heart failure is diagnosed, as I earlier said, we have plenty of treatment. We have got newer medical treatment which is available to us, newer drugs which can control heart failure. And when the medical treatment fails, then we have got different devices which we should be capable of putting it, or which we should be putting in our patients. So these devices include, initially we call it as something like a pacemaker. It is a CRTD device where we synchronize the heart activities. Both the chambers of the heart work in a synchronized manner, so the heart function gets improved. But it only improves the heart function by 5 to 10%. Other things which are available are ventricular assist device or left ventricular assist device. The left ventricular assist device is a mechanical device which takes blood from one chamber of the heart and puts in the other chamber. It's like in the aorta. It's like almost bypassing the heart and taking over the heart function completely. So this is a very effective method of treating heart failure, which is being advised to the patients who go to the end stage heart failure. And they, after this ventricular assist device for LVAD, patients lead normal life. I have got plenty of my patients who are already on LVAD, where we have implanted LVAD, and after that they are leading normal lives. They have gone back to their jobs, they have gone back to their family life, they are performing their daily activities normally. And once the people, they are beyond that, then this we call it as, then they go for heart transplant. So heart transplant also is one of the options for heart failure, and it is especially for the patients who are below 55 or 60 years of age. Above that, we have to either put LVAD or a pacemaker or a CRTD device. So heart failure, first of all, we should try to prevent it if it is preventable by controlling diabetes, controlling hypertension, controlling smoking, leading a healthy lifestyle. And if unfortunately somebody suffers from a heart failure, he should seek the advice from a cardiac surgeon or a cardiologist. And after taking their advice, and if they are being advised for some devices like LVAD or CRTD, they should go for that. So the treatment of heart failure is continuum, like you have to continue one thing after another. Once the medical treatment fails, then you go for devices, and if they also don't work, then you go for LVAD or heart transplant. Thank you very much. I think all of you will take care of your heart and prevent yourself from going into heart failure.